Kia ora, I'm Tamatoa Blaiklock. I am a general practitioner in Kirikiriroa, Hamilton. Being on the Pinnacle board was really important to me because I was really scared of them. When I first interacted with members of the Pinnacle board, all of a sudden in that space I felt like that little poor brown kid again. And so I kind of challenged myself to join the board, because if I didn't feel like I had agency in that space, what hope was there for agency for the Pacific communities that I represent in the health system? It's really important for me to advocate for Māori and Pacific communities just because of who I am. I am of Samoan heritage. I was raised by a solo mother in South Auckland, and access to a doctor, especially for the chronic conditions I had, such as asthma and chronic ear issues, was quite hard. There were many barriers, and when we got to access health professionals, I was often very anxious. They didn't look like me. So one, I think just being present in the board table with who I am and my heritage it just highlights to others from my community that it is possible to be in leadership roles and that our voice is important. And two, to just keep pushing for Māori and particularly Pacific equity. Our outcomes are terrible, but that doesn't mean that the mahi is not good mahi. So it's a real privilege to be able to bring the Pacific voice into the boardroom, and a real privilege to make it real for our patients, to direct funding to equitable causes that are really specific to our Pacific communities into Manuataki. When I became an owner of a practice, all of a sudden I had a responsibility to the community, to ensure that general practice ran well. It's really easy to get bogged down in the day-to-day of general practice. Good governance ensures that you rise above that and are able to make decisions strategically and not out of being reactive. The GP voice at our board table is really loud. Naturally, as GPs, we bring the patients into the room with us. What I mean by that is, often when we're making decisions on policy or distribution of funding, it's very natural for us to think about how this would affect patients that we have. And very specifically, often when we're making decisions, there will be a patient I have in mind. How will this decision affect this patient? How will it affect their families? Pinnacle is definitely very clinically led. Our board room is made up largely of general practitioners. GPs are kind of like the MacGyvers of the health system. That kind of ages me, in that we are very used to bringing out the best outcomes as possible within the constraints of the resources that we have. Being GP led, we bring that kaupapa into the boardroom as well. We run very lean as a PHO, but we still perform well in terms of outcomes for our patients. We influence outcomes at a governance level primarily through accountability. So our presence there ensures that management are accountable to us advocating for our GP peers, for our general practice clinics, but also for the populations that we serve, both enrolled and unenrolled. Pinnacle is staunchly an equity-focused organisation. What I've been really impressed with currently is that in this political environment, more and more policy is drifting away from equity, and we've had to make some really tough calls as to whether we would continue our strong kaupapa of equity first, or we'd follow where the health sector's gone. And sometimes these decisions translate to actual dollars. But we've decided that to remain equity focused and to be largely a te tiriti driven organisation. Pinnacle was formed by GPs. We continue to be a GP-led organisation, and our practices are always first and foremost in our minds, especially around the board table. In terms of outcomes and equity, our practices perform really well. My hope is that we will continue to keep doing this mahi together, but please, if we can be doing it better, let us know.